Hello everyone. My name is Ala Samarai, a dentist who graduated from King Abdulaziz University, and I currently work in a private medical college. I have been in charge of infection control for more than a year now. Firstly, I'd like to express how pleased I am by the decisions and precautions taken in the country so far. I think that the Kingdom of Saudi Arabia are doing a great job at combating the current pandemic caused by the coronavirus, and in order to prevent all the efforts made so far from being wasted, each one of us needs to do our part by not leaving home unless it's absolutely necessary. And for sure, one of the necessities of life is food. Today, I'll be talking to you about two things: precautions you need to take when you go grocery shopping, and how to deal with your groceries when you're back home. Let's first start with some general advice. Okay, I'll explain some basics. In order to control this infection, we need to first focus, and second, to avoid doing something we call in the medical field cross contamination. The definition of this word in Merriam-Webster dictionary starts with the word inadvertent, which means that the person does it without realizing that they're doing it, which is to move, let's say, germs from one surface to another. So if we understood what cross-contamination is and focus just a little bit, the job is done. It would only need some practice in order for when to get used to it as a skill practiced on a daily basis. Also, there are another two concepts to bear in mind. The first is one of the very basics of infection control, which is to treat any patients that attend the clinic as infectious, regardless of what kind of infection it is. Why do we do that? It's because the patient might unknowingly be a carrier of an infection and not realize it as symptoms have not yet started. So we must use the same concept in dealing with the coronavirus, and that is to assume that everything around us is contaminated by the virus. In order to tell you what the second concept is, I have to first explain the difference between two terms, which are the first, sterilization, and the second is disinfection. The process of sterilization is usually done in hospitals and clinics, where medical instruments are put in an autoclave under pressure and at a high temperature in order to kill all microorganisms. Only such instruments can we consider sterile. Everything else we clean, whether it's being sprayed or, for example, hand washing, we can only consider disinfected. Because what we do is a reduction in microorganisms, and we can never guarantee that 100% of the germs have been killed by practicing disinfection. So the second concept we need to keep in mind is that because we cannot guarantee that something we disinfected is now 100% clear of microorganisms, we need to continue practicing our precautions. So why can't we guarantee that we have disinfected any surface thoroughly enough? For three main reasons. The first depends on the strength of the disinfectant. There are strong disinfectants as well as average or weak ones. Secondly, if I now spray the surface, can I possibly guarantee that I have covered every millimeter of it? Of course not. And thirdly, as the factor of time. In order for any solution to disinfect, it must be left on the surface for a certain amount of time, which depends on the manufacturer's instructions. This one, for example, recommends 5 whole minutes, whereas the one we have at work recommends 30 seconds. Whatever the manufacturer recommends, we need to follow. However, who is going to keep track of time by looking at the watch? It's impractical. Even if we spray the surface and say leave it for a good 10 minutes, the surface might have dried off before enough time has passed for it to be disinfected. So for these three main reasons, we can never guarantee that the surface is clear. Now let's start the practical part. Now, in the stores, they're taking some quite good precautions, such as the following. except for wearing gloves, which is absolutely wrong. The Saudi Ministry of Health has recommended not to wear gloves for two good reasons. The first is that one would wrongly start thinking that their hands are clean and so not wash them frequently enough compared to when they're not wearing gloves, where they can feel their hands get contaminated and immediately go and wash them. So without wearing gloves, they'll end up washing their hands more often. The second reason is that anything contaminated you touch, you'll end up spreading on everything else you touch. So everyone might think they're protecting themselves, but actually everybody is increasing the risk of infection for everybody else. So don't wear gloves. But when it comes to wearing masks, the guidelines say that only symptomatic patients should wear them. However, it isn't harmful to wear a mask like it is when wearing gloves. Okay, so I'll give you one exception to when you can wear gloves or should wear gloves, which is when you enter the fruits and veggies section. And I'll tell you why. But first, let's imagine the wrong scenario, which unfortunately the great majority of people are actually doing inadvertently. So they wear gloves from home or as soon as they enter the supermarket. Imagine how many things they would have touched before reaching the fruits and veggies section. From doorknobs, steering wheel, everything else at the supermarket. I'm not just referring to items at the store, but the shopping cart, another person, their mobile phone, the glasses. So they basically touch everything and then go pick their fruits and veggies. So it's actually like making sure that absolutely any contaminants will be transferred to the fruits and veggies they picked. So why do we need to treat fruits and veggies in particular differently? Because they're almost the only type of food that we cannot disinfect, and so we must be careful with them. So moving on to the correct scenario, when we enter the fruits and veggies section, that's when we can pick up a pair of gloves. So we need to focus here. When we pull out gloves from a box, we should touch them from the part which lies on the wrist and not touch the part that covers the fingers so that we do not contaminate them and then contaminate everything else we touch, which is the fruits and veggies we're going to pick. So like this, as we can see in the video. Okay, so sometimes in sterilization, we do dual packaging, where we put the instruments into 2 layers of pouches. And so this is what I applied today at the supermarket and would like to show you how to dual package fruits and veggies. Any bags we see put on a surface, we must know it could be, or most probably is, contaminated. However, we pull these bags at the store from a hanging roll. So we take 2 bags and we prepare as many bags we need depending on how many different types of fruits and vegetables we'll be taking. So we open the first bag and then the second one, and we need to be careful again not to place our hand inside the bag in order to open it, so to prevent cross-contamination. So like that is shown in the video, and we prepare as many as we need all together right at the beginning before gathering the fruits and veggies. So after we're ready, we start gathering our fruits and vegetables and we drop them inside the bag. When we are done, we tie up the bag inside first separately and then the outer one. And this technique will help us out later when we're back at home. There's also another thought we need to keep in mind. Doctors, when they scrub in for operations, they usually keep their arms upright like this to ensure they do not touch anything other than the patient and the instruments. This way they remember not to touch anything contaminated and transfer it to the patient. So we can apply the same idea. Yes, sometimes staff do disinfect trolleys, but as we mentioned earlier, we cannot guarantee that it's absolutely clear from contaminants, and so we need to continue with our precautions. So we try not to touch the trolley or scratch our heads or hold our phones. If we'd like to take a call, we can remove the glove, take the call, and put it back on afterwards, or grab a new one. It's also worth mentioning that gloves should never be disinfected. Gloves are disposable, so are to be used once and then thrown away. If you need another one, get a new one. So we can use the backs of our hands to push the trolleys instead of doing it the usual way. And be careful not to touch anything until we're done. So as soon as we're done from the fruits and veggies section, we can go ahead and take our gloves off and continue the rest of our shopping. So now we're back home. We put all our groceries to one side until we prepare our counter to unpack and disinfect what we bought. So like I mentioned earlier, when we spray surfaces, it's not possible to cover every bit of it. So we'll be using a technique called spray, wipe, spray technique, where we spray, then wipe, but with the intention of spreading the solution on the surface to allow it to take action and not to remove it. So we spray, and then we wipe the surface very lightly to avoid removing the solution and instead to spread it on the surface. And then we spray again and leave it for as long as the manufacturer recommends. Then we wipe it off. Another technique is called wipe, discard, wipe technique, where we wipe, throw away, grab another one, and wipe again. And for this technique, wipes soaked in disinfectant are used. Either techniques will do. After our counter is ready, we split it into two sides, clean side and dirty side, which is usually closer to the sink. Then we start to bring our grocery bags. In general, away from the current pandemic, I do not like to place bags on the counters because it could have been placed in an unclean area like the place of feet in the car, for example. So we wash our hands and we start bringing our bags. And again, we must focus. Using the left hand, we'll hold the bag and we'll be careful not to touch the bag from the outside with the other hand. And we'll use it to grab the items from the inside of the bag. And we place it in the dirty side until we finish disinfecting it. Then we'll move it to the clean side. So we grab the bag and we carefully, with our right hand, not touching the outside of the bag so that we don't cross-contaminate, we'll bring out the groceries. So I split the groceries into 5 categories. I'll start with fruits and veggies. It's worth mentioning that the task would be much simpler if there was somebody to assist, where one would open the bags and the other, with clean hands, grabs the groceries from the inside without touching the outside of the bag. But if I'm alone, then I'll start by opening the bag. So we'll open the bag and without touching anything inside of it, I'll drop the veggies on the clean side, or bananas rather. So for the outer bag, because it could be contaminated, we can turn it inside out to prevent anyone else from touching it. As we have taken precautions at the store while gathering the veggies, they're considered clean, so no further action is needed. Then we move on to cans and packaged items. We have 2 options. If I'm not going to use or need the item within 3 to 4 days, I can simply just store it until the time passes and wash my hands after storing it. Alternatively, if I'll need to use it, we'll spray it and wipe it. And watch me do a deliberate mistake. If I do this, what have I just done? This is what we call cross-contamination because I touched it with an unclean hand. Yes, I cleaned it, but recontaminated it by my unclean hand. See how easy it is to inadvertently cross-contaminate? So I either wash my hands before I start spraying the items, and I spare one of my hands to stay clean. So I wipe with a hand and then grab with the other clean hand to move it to the clean side. Or after wiping it, I move it using the tissues. Of course, if I had someone to help, they can move the items with their clean hands. It's better to have a clean hand to also handle the item after disinfecting it in order to wipe it from beneath. Items in cardboard usually have a bag inside that no one has touched. So I can simply open the box, again being careful not to touch it from the inside. And I simply drop it in the clean side. If I have stuff in a bag that hasn't been duly packaged, like nuts for example, I would have already prepared a container for it in the clean side, or I could wash my hands and grab one and simply empty the bag contents in the container. Again, being careful that the outside of the bag does not touch the container. So we're done with 4 categories. The 5th is frozen foods. Some people say coronavirus can survive in freezers for a long time. Others say there are no studies that have proven that. But generally speaking, microbes usually don't survive in extremely hot and extremely cold environments. So regarding frozen foods, if you'd like to disinfect them, you can do so. But at the end of the day, it will be stored in a very low temperature, and the contents will be heated before eating. So when we finish, we get rid of the contaminated packaging, and then we wash our hands, and then move anything in the clean side to wherever we need to store them. To finish off, I hope you found this video useful, and what I hope more is that after we're done with that pandemic, that we don't go back to our bad habits. Most health problems we face throughout the year, from flus and stomach upsets, are usually because we were careless about infection control and hygiene in general. If you found this video useful, please do share it with your loved ones, and remember, we're all responsible to do our part. Follow us for new videos and stay safe.